are they being addressed? The plan of care is an ongoing process. It is not static. It should be individualized to each patient and family based on their goals. When you're in IDG and when you're talking about the plan of care, as the patient gets sicker, the goals should change, and you should have some changes to your plan of care. So a word about goals. They are patient and family directed. They are not the IDG's goals. They should be measurable. They're fluid, not static. They have to be flexible, and you have to be able to change as the situation requires. And you should review them anytime there's a significant change in that status. So let's go back to the example, I want my hair done every Wednesday. That's a patient's goals. So how do we do that? Well, your care planning, your IDG, should then be focused to support all that needs to happen to achieve the goals of getting the patient's hair done. And so what is the role of each discipline? Well, the nurse has some responsibility, the nurse physician, to make sure that the interventions are appropriate to manage the pain and symptoms. There is transportation that has to be arranged to the beauty shop. There is support and make sure that the bath and the patient is dressed and ready and all of her ADLs are done early enough so that she is ready to meet her appointment. There's safety needs. Well, can she go to the beauty shop unattended? Does she need a walker? Does somebody need to help her there? What else goes on that helps to make that happen? And how will the goals of care change? And how does the plan of care change when she can no longer leave the house? Well, then at that point, is it somebody come in? Can somebody come in to do her hair, or is it the hospice aide responsibility? So begin to think through how do you focus on the patient and how they become the center of the plan of care. So here's some actual documentation, and that the nurse documented the patient was experiencing some cabin fever, and the daughter asked, do the rules allow him to go out on outings, appointments to his podiatrist and the dermatologist? When we reviewed the plan of care, there was no problem or needs related to this identified on the plan of care. Nothing was measurable, but there's lots of issues. None of them had any corresponding goals to address the cabin fever or the outing. So the patient had caregiver issues, elimination, grief, depression, respiratory, tasks of dying. How could this have been better developed to a patient-centered goal? What would some of the interventions been? If the patient had cabin fever and was still able to go out, then part of the goal should have been maybe the problem was social isolation, and the goal was to have the patient have some outing once a week as long as he was able. And then your interventions are built on helping that patient to alleviate some of that social isolation. So what should I